Yes.
Hello one and all, I hope you can see us. We are having a few problems with our
with our technical
today. Charging and turning it the wrong way round.
I'm trying not to make you sick. I'm going to move it again.
So hopefully you can see us. We've had to rearrange a few things, and hopefully that's it. You can see me, and can you? Yes, you can see.
We're a bit low actually, aren't we?
We are a bit low today. I'm sitting on a cushion already, so hopefully you can see us and you can hear us. Here we are Thursday again. That's come around quickly, hasn't it? And we are the infant feeding team at the John Radcliffe Hospital in Oxford. And this is our hourly questions and answers session, which is open to anybody that is wanting to know anything about feeding. So we've had some amazing questions every week, and they continue to come. And so hopefully today will be on trend again. And you know, fire everything at us. So if you're breastfeeding, if you're bottle feeding, if you're giving formula, if you're weaning, if you're wanting to talk about sleep or pre-birth or collecting colostrum, anything at all, put those questions to us, and questions are repeated a lot. There isn't a huge amount that you can do with breastfeeding. It is the same stuff, but we go over it and over it and over it, so we can always revisit everything frequently, and that embeds it, and then people that haven't listened into this session before, welcome, and hopefully you can get lots out of it as well. So any problems at all, do contact us, and hopefully we can answer them. Not too personal, if you just generalise your things, and then we can answer them generally rather than personally. And then if you have got a personal question, ask generally, and we can always call you, or you can call us after the session, and we can talk to you directly about your individual problems. We're not here for midwifery questions, so if about water birth, or about mode of birth, or about what's available in the community at any time, so they can be directed to us midwife sessions, or to your own midwife, or you can look on the Women's Centre website, the Oxfordshire OUH Foundation Trust website, and that should give you the right answers up to date, because we don't always know the answer to everything.
Don't we?
Oh.
No, we don't. Not all of it. We do know a lot, but we don't know everything.
And we do know lots about midwifery things, but actually it's not the right place for it here. So if you have got burning questions about your pregnancy that's not feeding related, then take them elsewhere and get them answered by your the correct person, really. Your
community team, or you could go to do Wendy Randall's Ask the Midwife sessions, which she runs.
It might be the week on Monday where there'll be a session.
So
there's one this week.
No, she's on leave this week.
Okay, so it'll be the week after that. So it's Bank Holiday Monday, isn't it? So she'll be back answering questions for you again. So we're an hour session, and put your questions down there. That would be great. The other thing is, let us know where you're from, because we've had an awful lot of people watching us recently. And are you all from Oxfordshire? It'd be really nice to know if you're from further afield, and which part of the country are you in, or which part of the world are you in, because some people are watching from much further away. Let us know. It's really interesting to hear how you found out about us, or if you've been recommended by somebody, because we want to reach out far and wide to everybody and tell people about us, and let them tune in as well, because it's very helpful in these difficult times where not everything is opened up still, where you can get really accurate advice, the right advice, which is really important.
I think the other thing to say today is that this is World Breastfeeding, Black Breastfeeding Awareness Week. So, you know, the reason for that is that there are still inequalities when it comes to it. So there's some really interesting resources out there if you have a look. You were having a look just a moment ago, weren't you?
I was, and it's there's quite an interesting website called blackbreastfeeding.org, which has got lots of information. I think it's probably American, but it's you know, the same information for everybody all over the world, and explains what it's about and why they're doing it, and you know, that it's been 40 years since this has been sort of talked about, and you know, it's the 9th year of Black Breastfeeding Week, and it's the big pause, collective rest for collective power, is the theme for this year, and they've got lots of creative events that are going on, and lots of stuff going on throughout the world about it all. Just having a look to see what else they've got there. So let's have a look at about it. and see. So, and there's also information on the OMVP web Facebook page as well. They've got a little thing about it, which is really helpful. So that's about, it was created because of over 40 years there's been a gaping racial disparity in breastfeeding rates. So Black Breastfeeding Week is dedicated to promoting awareness, highlighting triumphs and challenges of breastfeeding for Black women. And there's links to various stories. So it's a celebration of women all over the world that are breastfeeding, but also highlighting the fact that there are inequalities in support for breastfeeding women and initiation of breastfeeding, which I think is quite a big thing, that then babies will not do as well if they haven't got the same start equally to all the other babies around the world. So I think it's just highlighting that and making it more normal in different cultures, in different countries. And I think that in our own country as well, in the UK, it's the same, that there are inequalities with it. So we're just celebrating women, celebrating the power of women, and supporting all colours of women that are breastfeeding, and making it higher profile and supporting it.
Yes, breastfeeding is universal, regardless of where you come from, colour of your skin, everything. So the Breastfeeding Network have got a post up on about it, Black Lives Matter, how the Breastfeeding Network is working to tackle racial inequality. So their work is always really, really good on the Breastfeeding Network. It's a good resource to have a look at. So they've got some stuff on there, which is always worth a look at if you're interested. But, I've seen we've had a few questions coming up, actually. They've been popping up over. I've seen we had a hello from our lovely Sharon Ling.
Hello, Sharon.
Hello, Sharon.
Hope you're well.
Yeah. Doing your great jobs out in Chippy. Natalie has said, myself and baby Delilah, 7 days old, currently feeding whilst watching from Didcot. Well done you, lovely. So congratulations. A week old. It's amazing, isn't it? You can't believe it. So, and Alicia has said, can breastfed babies become uncomfortable if they've eaten slightly too much? My 4-month-old has always been a happy spitter. She's recently had her 14 weeks jabs and was nursing for comfort, but would seem uncomfortable after until she'd spit up a few times, more than the normal amount. I couldn't tell if it was just from the jabs or overeating, but she would appear more comfortable after spitting up. Yeah, she's probably having, the breast is there for comfort as much as it is for food, so she probably is feeding from you in order to make herself feel a bit better after her jabs, and may have taken a little bit more than she actually wanted. So. But
also she might have increased your milk supply a little bit by doing a couple of days of comfort suckling, and then you've suddenly got more milk, and she's transferring the milk and getting a little bit more milk in her feeds, and it will probably settle down again. But that's brilliant that she's managing to feed well at 4 months and doing all of that. And isn't it lovely to be breastfeeding when they have those little things that happen in their lives, like the immunisations or whatever, that can comfort them, because breastfeeding is more than food.
Yeah, it's the most fantastic mothering tool, being able to breastfeed your baby. So it's lovely to think of Natalie out there feeding her Delilah at 7 days, and Alicia feeding her baby at 4 months. That's so lovely. So it's wonderful.
And it's for all things. So going to sleep, and when they wake up, and in the middle of the night when they feel alone, if they're in a crib next to you, if they're feeling a bit off under the weather, when they're hungry, and anything else in between. And as they get a little bit older, if they have a little tumble, or if they feeling a bit unsure and they're starting in daycare, all of those things will help breastfeeding, your baby with breastfeeding. It is everything to them, and it is their world. So it is a resource that you can call upon for all levels of development.
Wondering if we had our poster there, the one that we did about the breastfeeding one. I don't know if we've got it here today.
I don't think
we've got one. We did a poster with a gorgeous baby in the middle, and it talked about why babies breastfeed, and it's way more than just food. They feed for comfort, they feed to check in, they feed because they're cold, they feed because they want to know you're there. So there are so many reasons. And you can do that too as a mum. There's no reason not to just feed when the baby's looking for it. If you're feeling full, you feel like you need an oxytocin rush because you're feeling a bit low, you just need that cuddle or an excuse to sit down. That's a perfectly good reason to breastfeed, and babies normally will be very compliant and very happy to have a feed.
And I think also, when you do start, your baby does start going to nursery, or into childcare, they mix with other babies and they catch everything, don't they? They come back with tummy bugs and colds and all of that. And actually, if your baby has a tummy bug, you can still give breast milk, whereas if you're giving formula, it's very difficult to give formula when they're vomiting because it makes them more sicky and it tends not to stay in their tummy. But if you breastfeed with a baby with a tummy bug, it hydrates them more. It's sort of their hydration as well, so they can breastfeed throughout all of that, and it doesn't make them more sicky. So that's really nice to know, and you also will probably produce the antibodies to support the bug and to give more protection for a bit later on. You start developing antibodies to protect your baby as it develops, for socialising in areas where there's lots of people, and you touch things and you meet other mums and you meet other babies, and you develop antibodies to some of the bugs that the other children have, and that's passed on to your baby through breast milk. So if you get sneezed on, within 20 minutes of you being sneezed on in a bus, say, your breast milk will start to make antibodies to that sneezing bacteria. So if somebody's got a cold or a cough behind you, it will produce protection against that bacteria, so that when your baby breastfeeds, within 20 minutes it will start to get the protection that it needs to protect the baby, your baby, from getting that bug as badly or at all.
Which is why we keep mothers and babies together, and why we don't anymore have the situation where babies are taken away from mums, which used to happen when I had my first child. They were put in a nursery overnight, and I think the same happened to you, and you've worked on the wards in the past, haven't you, when babies were taken?
We took all the babies from the mums at night and put them all in a big row and used to look after them all night, and the mums slept all night, so that was quite an interesting one. We had like a bit of nursery going on at night when we worked here. Or they were, in some of the units they were given sterile water, and the mums were giving sleeping tablets. So we've moved on a lot, but the offset of that was that I used to walk around with a big bowl of really warm water and flannels for all the mums, and they would put it on their breast because they were so engorged. Their babies weren't feeding responsively, which is how we work with breastfeeding now. So mums don't get as engorged as they used to. They would really fall on day 3. And we used to use warm flannels and cabbage leaves to stop the engorgement. We had cabbage leaves in the fridge, and we used cabbage leaves. So this
seems mad when the babies were there and would have been doing a much better job, really and truly. It seems incredible. And yet, so we know that time that you spend in close contact first, after birth and the first few weeks are so important for your milk production. So, that's why one of the basic tenets of the baby friendly initiative, the UNICEF baby friendly initiative, is rooming in, that babies stay with mothers and there's no separation. So, when you have your baby, the intention and the expectation is that your baby will be with you 24 hours a day, right next to you. And that's how you learn about their cues, they learn about you, and it doesn't help for them to be taken away. So it's although it's really hard, but actually many mums don't want their baby taken away. And I can tell you now that, I remember waking after I had my first baby in the night, and my baby wasn't there because it was in the nursery, and you're like, oh, where is my baby? And actually you do want your baby back because you want to keep them there. You've carried them around for 9 months. The last thing you want is for them to be taken away. So that keeping babies close is really important. I'm going to go on to Ali. Ali's put a message on here. She says, just wanted to thank you for these sessions. They've been so helpful. I'll be 34 weeks tomorrow and will be coming to the JR to have my baby. I've been having high blood pressure at my regular appointments, which appears to be white coat syndrome. My midwife suggested an epidural in labour could be an option for me to help keep my blood pressure down. But she just wanted to know, can having an epidural have an impact on breastfeeding in the early stages?
Sometimes it can, yes. You've got something called fentanyl, which is a very strong painkiller, and tiny amounts goes into the epidural to make you numb, and it is a morphine derivative, so it does pass through to your baby, and so it can affect your baby in the early days. Maybe for the first 24 to 36 hours your baby can be quite sleepy, but saying that, it's very important that you have the right pain relief for you in labour, that it's the right thing for you, and it's all safe. It's just that it can make your baby a little bit more sleepy in the early days. And I think one of the things that we talk about all the time, don't we, Alex, is about protecting your supply. Yeah. And that means if your baby isn't playing out its cues to breastfeed because it's very sleepy, babies often in the early days have a tummy full of yuck as well, and so they they're very mucousy. Certainly in the first 12 hours they can be quite sicky, and once they get rid of all that, then they start to receive milk, but the colostrum pushes it through and gives the baby the calories that it needs to sort of wake it up and make it want to feed and start the whole process. But if they're very sleepy, they don't often play those out straight away. So you have to do that. Your hand expressing in the early days is the milk driver that drives your supply. And so if your baby isn't feeding frequently, we say 3 feeds in the first 24 hours, but we say hand express for the other times.
So, I mean, your baby's only going to be 34 weeks, so actually you really, really do need to be hand expressing. And the risk of your baby having jaundice is increased because your baby's going to be early. So hand expressing from straight after birth is really important. And if you can do a little bit beforehand, if you've got a bit of time before you have the baby when you're in the hospital, and get someone to give you a hand, to talk you through it. They shouldn't be doing it for you, you should be doing it, but they can talk you through it and teach you how to do it. So if you've got a little bit before you even have your baby, that's great, takes the pressure off you straight away, but we do need you to be expressing from soon after birth, within the hour or so. But you'll have something to give your baby then. The more you give, the less likely your baby is to be jaundiced, the more they're going to wake up, the more they're going to get rid of that yuck that's in their stomach that Naomi's just mentioned, the less likely they're going to lose too much weight on day 3 and 5.
So you have milk.
It's just a total positive cycle going on. So I highly recommend that you get on with hand expressing as soon as, when you come in and after the baby is born, Ali.
Everybody should learn that skill. You don't have to collect colostrum. You don't have to do that with a syringe if you don't want to, but actually you can learn that skill. And you can do it in labour as well, so that you can, it will be beneficial for you in labour, so you can practice doing it in labour, and then you've got some fresh colostrum to give your baby when it's born. And it's okay on the side for 24 hours, so if you have a labour of 12 hours and you've hand expressed for that time, it's fine to use. And it means you don't have to worry about stuff if it's at home. You don't have to worry about it going defrosting and not being able to be used after a certain amount of time. And also that it gets lost in transit sometimes if you're moving from department to department. So do it while you're in labour, and then it's all there ready for your baby. But keep doing it afterwards as well.
Because that's what makes the difference. We talk a lot about expressing in the antenatal period, but what a mother does prior to having the baby has no impact on her milk supply. Everything she does after the baby is born has an impact on the milk supply. So we have mothers who can collect tons and can do so before they come in, and then feel that they don't need to perhaps express once the baby's born, but actually unfortunately that is when they really need to be doing it, because it will not have an impact on the supply, and the baby's then not driving the supply because they've got other colostrum. So having some when you come in is a bonus, but it does not replace expressing once the baby is born.
We could have a little session on how to do hand expressing, but we've also got a video on our infant feeding page which shows a mum expressing. She kindly allowed us to video her when she was doing it, so it's easier to see when it's on a real breast and a real baby next to her, and what's really coming out. You can see that her milk, I think she was about day 2, wasn't she, when she did it, and
but she was a second time mum, so it's coming in a bit quicker.
So, don't be afraid to do it. You're not going to do anything terrible, but we don't recommend that you do it before 37 weeks if you are having your baby at normal time. If you're thinking you're having your baby early, as Alison said, she's probably going to do it 34 weeks. Then just do it before you go in to have your baby, so that you're not starting labour off too unnecessarily. It's all under control then.
So doing it during the labour, because if you're going to have an epidural, we're going to be trying to get you into labour. That would be the perfect time to do it. Once your epidural's up and have a go then, that would be brilliant. Pop it in your birth plan. Right, please can I be taught how to hand express during labour? Assuming you've got a good epidural on board, you will be able to manage that.
And if you're an inpatient, let us know and we can come and talk to you, or your midwives on the level can show you how to hand express if we're not around. And it's time critical because you're going to go in to have an induction, so if someone can do it with you while you're waiting, and not necessarily get you to do it, but they can show you how to do it again. So we'd say with your breast, you go 2 to 3 centimetres behind the base of the nipple. You use your fingers like pincers, so it's like a pincer action. It's not that, because that's sort of rubbing. You want to really direct the fingertips onto the receptors in your breast, the ducts in your breast, So move your fingers 2 to 3 centimetres behind the base of the nipple, and your breast is like a clock face, so it goes all the way around. You can use your hands in any area that you want to, and you will find your sweet spot. And make sure you're private, that you're not being observed, and that you feel safe doing it, because it's a very shy hormone, oxytocin, so it doesn't let anything come out if you're stressed. And it's the same when you've got your baby with you. If you're not feeling comfortable doing it in the place you're doing, then take yourself somewhere that is comfortable. So you might want to go into a bathroom and do it, you know, where you're not observed, and sit and do that quietly if there's people in the room with you. And then with your finger and your thumb in that C shape, just push slightly back on your breast, hold down, and you're going right into the breast. You see, you're really imagining that you're putting the areola, the darker little round bit at the base of your nipple. It's almost like you're putting those two edges together. You're imagining, you don't need to do it that far, but you're imagining that you're putting those two pieces together, or you're putting your finger and your thumb and meeting them and touching. It'd be unlikely that you can do that, but you're imagining that you're doing that. So you hold for about 4 seconds, and then you release, and then you push back and hold for about 4 seconds and release. Now if you're doing this, rubbing, and your fingers are straight like that, you're not going to get the same response. So if you're listening on the ward and you're watching us and you're just learning how to do it, or you're doing it at home, have a go and see how it works and come back to us. But don't do that. You want to do that, because if you're rubbing, it's not going to attach deep into the ducts of your breast. So it's really getting deep in your breast and holding, squeezing, holding, and then releasing. And then you move around the breast, and before you do it, you might just want to sniff your baby if you've got your baby with you.
Smell their head.
Absolutely. And then rub around your breast, so you're rubbing your breast and just getting the flow going. And you can collect in a spoon, or you can collect in a little tiny syringe, the ones that we use here, that you see us talking about all the time. But you can collect while you're doing that, and some people go like that, and they hold it like that and then pull it up.
And that's what you'll see on the video. The mother on the video manages to collect her own colostrum, which is why she was perfect
like
candidate.
that. Or you can get your partner to do it if you're comfortable with that. But a spoon is good. You can do it onto a spoon and then suck it up into a syringe when you've got a little blob in the spoon. But you know, you get tiny little bits. You don't get syringefuls like that very often. Some people do. We've had mums ring us and say they've got 20 of these, but
it's rare,
unusual.
very rare.
This is more normal to have that sort of amount, and that's a good amount when you're doing it early on. So you know, don't be hard on yourself if you don't think it's working, because it actually is. And those little bits, and what you're doing is you're learning a technique, and that's more important than anything else. But you will see little sort of shiny globules appear, and then what will happen is it'll start to flow. So then when you've done one side, go to the other side and do the same on the other side, and then go back to the other side, because the flow has started by then, and then go back to the other side again. And you'll find that you get more milk doing it that way, or more colostrum.
And I think, don't be disheartened. I think you have to have a belief in yourselves. You know, we've been supporting a mother recently who, on the first day I met her, she wasn't getting anything, and then by the end of sort of a few hours with her, you know, going backwards and forwards and teaching her how to hand express, she could see glisten. So literally, it begins to look like just little bright sparkles on the nipple. And then you could see that they'd been there, because when it dries, it goes like dried sugar, because all crusty. And then by the next morning, she was getting enough to collect into a tiny bit onto the syringe. And yesterday she pumped
55 mils.
There you go. And that's within that. I first saw her on Tuesday, and so
tiny drops, and in 24 hours she got 55 mils.
So that you have to believe in yourselves. Just because it's not coming straight away, don't think it's not going to happen. You need to be really confident and just go, I know it's going to happen. I've got no risk factors if you have none. But we always assume a mother will produce milk unless proven otherwise. So, you know, we would say it's frequent and effective stimulation, and your milk will come in, even if you
so hard, hasn't she?
You may only see the slightest of a glimmer to begin with, but once you get going and you've told the body the baby is here, and you tell the breast to get on and produce milk, they will do it. They've grown a baby, the body's grown a baby, your breast will produce the milk as long as you ask for it. If you don't ask for it, you won't get it though.
And the other thing was, the more I sat and talked, The more she relaxed, the more it squirted out. So, after 15 minutes of chatting, 20 minutes of chatting, and we don't look at the clock, we just look at what's coming out.
We go by the flow.
It was just squirting out, and that was from tiny little drops the day before to actually getting milk coming in spurts, and that was her relaxing, talking about her family and her baby and everything else, and she just switched off, and her oxytocin started to flow and the prolactin started to get hit, and here it came, and it was just so empowering for her.
Which is why we say to people, if you are pumping, put your favourite music on, put a box set on that you really like, be in a room where you're not going to be disturbed, be somewhere comfortable, and think nice thoughts, and it will start to come. So,
absolutely. And if you're in the ward and you're struggling, and it's a bit strange having a newborn baby in the first 2 or 3 days, and if it's your first baby, you certainly don't talk out loud to it. It's all a bit quiet in there, apart from babies crying, but there's lots of banter and yattering, but you sort of haven't got that confidence to be like that with most mums aren't confident with their first baby. It's sort of not spoken to, but actually have a dialogue, or think about your dog, or think about your firstborn, your pet, and think how much it gives you joy, and talk about it out loud, and all about what it does, and what makes you feel good about it when you're stroking it, and those things make you start to produce milk, because it's very tactile, it's very touchy-feely, and that is very much part of relaxing and getting the stimulation that you get that you get pleasure from having at home. You're trying to recreate that feeling of happiness and relaxation, or smooch with your partner, even better.
So really go back to Ali. So answering her question then. So will it have an impact having an epidural? It may to some extent, but you're going to make up for it by lots and lots and lots of hand expressing, and keeping your baby skin to skin. We mentioned that, but that's really important too. Assuming your baby's okay at 34 weeks, having your baby skin to skin will be absolutely fantastic for your oxytocin, and get that milk moving.
And it's the first hour. It's the first hour where you get that skin to skin and hand expressing. If you are able to do it, makes a huge difference to your milk production in the long term. Huge difference. And if you get your baby to suckle a little bit on one side, hand express on both breasts, and then you will equal the stimulation, and so you won't have one that has more milk than the other in the early days, which is what often happens. So do stimulation on both, and don't take your foot off the accelerator. And people say, I wish I'd done that, because they're tired, they've had a long labour, they've had an outcome that wasn't what they were expecting perhaps, and the last thing they want to do is hand express and feed their baby, because they just want to roll over and go to sleep. But actually you can't do that. You've really just got to keep going, or you nap and then you do it, but do it before you nap, and then do it again, and just keep doing it, so that you get 8 good stimulations in the first 24 hours, and continue to get 8 good stimulations every day if your baby's not doing it. And that's most babies that we have on this postnatal ward on level 5 have had more instrumental deliveries, because they haven't gone home, and that's why they're in. So most babies that are well and the mums have had good deliveries, they've gone home. And so you're in hospital because you've had something more complicated. You've got medical problems, diabetes, high blood pressure, infections, and so you're more likely to have had a complicated delivery, and you're more likely to have had an epidural. And so that's where we're at on the ward, is that most babies that we have in for more than sort of 24 hours have had an epidural, and they are not feeding brilliantly. But we go round and round and round, telling the staff, the staff tell you, hand express, skin to skin, protect the milk supply. It sounds really boring, because the outcome is you want your baby to suckle, but if they won't, they won't. But you can help push everything through to make them do it if you get lots of colostrum out. And the double whammy is you start producing milk at the same time, and then you're ready for your baby when it wakes up at 36 to 48 hours and starts to say, right, okay, where's my milk? If you haven't done it, it's not there. It really isn't. And if your baby's had to have donor breast milk, and we talked about this last time, if you have donor breast milk, we expect you to be pumping to equal it. So we don't give donor breast milk without expecting you to be on the breast pump or hand express 8 times a day, because somebody else has done that for you, and it's a gift. So we you know, we will expect you to be hand expressing if you want to have donor breast milk for your baby, and all babies are entitled to, you know, to be offered it, but we expect you to be able to match it with expressing, not the volume, but the quantity of pumping, in order to make the milk to bring it on, so that, you know, you're giving back a little bit and helping your supply on, so you can get home yourself exclusive and make enough so that you can feed your baby.
Right.
So that's a really long answer, wasn't it?
So that was for Ali. So, hope
so
that's
good luck
okay.
to you, Ali.
And you know, if you need us, you know, if things aren't going brilliantly, then let us know. We say on these sessions before, we don't see you if everything's going well. So actually, those of you that have ended up seeing us, it's because there's been a complication. So, you know, come with the expectation that you actually don't want to see us. Because if you're seeing us, it's because things have gone slightly out of the norm.
The baby might have lost a bit too much weight, or it might not be feeding because it's very premature or jaundiced, or where else do we see babies? You might have got medical problems as mums, or anatomical issues, or you might have had
struggling with your supply.
Because you've got possibly polycystic ovarian syndrome, or you've got hypothyroidism, something like that. So if that's all ringing to you, that you've got those things, you should be asking to have a consultation with us. If you've had breast surgery, that could be implants or breast reduction, or any other breast surgery, then we would probably need to see you as well.
But so other than that, we don't normally see you. So the staff are all trained to help with, you know, normal breastfeeding support. So we only see those that are out of the norm, really. So because we couldn't see everybody anyway, and they are skilled to do it, and actually our staff love helping with feeding. I'm going to move on to Gemma. So Gemma has written, she has a 4-week-old baby and has managed to latch on the left really well, but for some reason can't latch on the right without a lot of pain. She's currently pumping on the right, feeding with a bottle, breastfeeding from the left. She's tried multiple positions but can't sort it. Any advice, please? Ideally, someone needs to watch what you're doing, Gemma.
Sounds like your positioning needs tweaking a bit on one side. Yeah,
so it's not going to be, you know, everybody thinks, oh, tongue tie. Well, it's not going to be a tongue tie if you're getting it right on one side and not on the other. So we're not going to be worrying about that. It's much more likely that maybe, as most women are, your breasts aren't identical and your baby needs to come on a slightly different position on that side. Sometimes babies have a slightly stiff neck after birth and find it more difficult to feed on one side. The way that we often approach it is to do one side across and then bring the baby round and do it underarm.
So you'd feed your baby this side like that, and then you'd sneakily try the side you can't do, and you'd sneak your baby around onto the other breast so that you can see that you're just sliding it across and doing exactly the same thing using the same hands. And that sometimes makes it easier for you because you're actually using the same things, and that means that you're more likely to get your attachment lined up better by doing that. So that's a bit of a sneaky one.
It's like pretending to have 2 left breasts. So because and that's the other thing, is that we are more dexterous usually with one hand, and you've said it's your left breast that you'll find it's easier. So it may well be, if you're right-handed, that's part of what's happening here, is that actually you find it a lot easier to bring your baby on because you are right-handed, bringing them onto the left, and then you bring them under. I'm not guaranteeing you may have done all of this already, but that's definitely one of the things we would try. And I think it's getting someone to help. At 4 weeks, you still come under us at the infant feeding team, so we would be able to see you to help you with this. Oxfordshire breastfeeding support would be good too. I'm presuming you've been discharged by your midwives and I now, so not them anymore. But
Health visitor.
Yeah, health visitor, Oxfordshire breastfeeding support, or us, and get someone to watch what's happening. And it might be a tiny change makes all the difference, because you're obviously, I would say you're more than 50% there, because you've got your milk supply, you're feeding really well on one side, we just need to tweak the other and get it right. So Gemma, I think...
Get someone to video you while you're breastfeeding on the side you do, and then get somebody to video you on the side that you don't.
And then watch it.
And see what you're doing that's different, because it will be very subtle, but you might be able to just see how you're approaching the breast on one side to the other.
It's remembering that your baby wants to come on chin leading, that they're going to literally just go on with the upper lip skimming the nipple. So, you know, thinking about that, now are you managing to do that on that side? That's pictures.
Your line up there. That's where you need to line your baby up, and are you doing that on both sides? And you're looking at the angle of your dangle as well. So you're looking at
where's your breast?
Where's your breast lying? Is it lying in a different plane on one side than the other? And then you bring your baby up onto that position so that you really get a good asymmetrical latch, and make sure you do it on both breasts.
So it's thinking about the fact that you're using a different hand more than likely when you're doing it. So like we said, we're pretending to have two left breasts, and thinking about the fact that most breasts are not identical. So one might point out more, one might point to the side and down more. So bearing in mind, and that's where a video would be really helpful to be able to see what you're doing. But by all means, get in touch if things don't get any better. So, but it's not uncommon. We've heard this many a time before, Gemma.
But keep practicing, because you will get it right eventually. You know,
Yeah.
if you're going on one side, on the other, make sure that your baby's tucked right into the contours of your body, not lying across you. So, you know, often mums are sort of in this position here, or they're lifting their baby and hooking them, but actually tuck them really closely into the contours so that your baby's tucked right round, even at 4 weeks, you know, so that, or if you're going underarm and feeding underarm, make sure your baby's tucked right round into the contours, and their feet are right round here, because actually you're looking at that asymmetrical latch, and your baby is lined up opposite the nipple, not opposite the mouth, so that when they lift their head back, they can get underneath the breast, and if they're too central, they can't do that, and they won't go on, and then the nipple will go onto the tongue, not into the top of the roof of the mouth, which is where the baby needs to be, right at the back of the roof of the mouth, so that it isn't rubbed. And if you put it down onto the tongue, and lots of mums push the breast down like that when they're putting their baby in and putting it onto the tongue like a bottle, and actually it needs to be the other way around. The baby needs to go up onto the breast. So it's actually very different action to that, which is what most mums will do, is push the breast into the mouth, and that will be really sore. It will make your nipple rub on the tongue, and you'll see it moving like that, and it will be really sore. So you've got to get right up. Imagine it's going into the nose, and keep it going into the nose. You don't want to see anything going down in breastfeeding. It's all going up and to the back.
But not only will you be sore, your baby won't milk the breast effectively either.
Yeah.
So it's a lot. There's a lot going on. If it's sore, then the baby's not got a good mouthful, which means that they haven't got a good mouthful to milk the breast effectively, which means it will impact on your supply. So being sore is an indicator that your baby may not be getting enough food, and you're not going to stimulate your supply, which then has a knock-on effect, because your supply won't go up as your baby needs it.
Or sometimes if you're not quite on the breast deeply enough, you go on and off, you make too much milk, and then that equals the same problem.
Which links into my next question.
So that's that way, and that's a nice deep latch that way. So you have a look at what's going on, and just see if you're doing the same on both breasts.
So Robin has written, my son is 2 weeks old and has been breastfeeding really well, but we've had no issues. However, the last few days when he latches on, he then pushes himself immediately off and looks really upset and uncomfortable and coughs. So I try a few more times, and then he eventually feeds, but not for long. Could I have an oversupply of milk, as I seem to leak a lot of milk when he lets go? Thank you. May not be an oversupply, maybe you've got a really good letdown, so that when your baby goes on and initially is attaching, they're getting really deluged with milk and can't control the flow. So that might be what's going on here. So thinking about positioning and attachment again, as Naomi's just mentioned, there is a link between babies that are coming on and off and not feeding brilliantly to an oversupply, or because they're not coping with it.
You're sort of on the end like this, feeding like this, and it's that deep one. If you're on and off like that, then that will stimulate you to produce too much.
So it's really important to get that positioning and attachment as deep as you can get it, for your baby to be able to milk the breast effectively and drive the supply. But they can also control the flow of the breast if they're on really well. Can I borrow a breast? So if they're on the end here, then the milk starts to pool in the mouth, and they can't cope with it, and they'll cough and stutter and splutter and come off. If the breast is right back there, they can control the flow, and the milk goes straight down their throats. So think about how you're bringing your baby on. It might be just because your baby's just that bit bigger, and just like Naomi's just said, having your baby in close and following the contours of your body, making sure they're coming on with their chin leading, will make a huge difference for most people. I met a
Can't show you that picture enough, can we? I hope
No.
it isn't reflecting too badly.
I think
can't
it's
see
okay.
if it's all there, but
Yeah.
just that is exactly what you should be doing.
Yeah.
You know, it's the nipple is just skimming the gum ridge at the top, literally just skimming over the gum ridge, so that you really get that deep attachment and goes right to the back of the throat. and it makes all the difference.
Yeah.
It's, you know, it's millimetres, but it makes all the difference.
I can't remember if I mentioned it last week, but I met a lovely mum last week, and the baby's weight had been it's been fluctuating. Sometimes it gains well, sometimes it doesn't gain well. And this baby was nearly 20 weeks of age, and this was not her first baby by a long way. And we worked on her positioning and attachment, and she messaged me back the next day. I saw her as an inpatient because unfortunately I couldn't see someone of that age as an outpatient. And she said it was better for what we've been working on. So it just shows that there is always room for improvement when it comes to positioning and attachment. So I think, Robin, have another look. Allow for the fact that your baby's that bit older now, it's probably grown a bit. Bring your baby round so that they are reaching for the breast, so they're coming on nose to nipple, then up and on. And that's really important to have a look. And if it's still not getting better, then get someone to watch you. Rachel has put a question up. I have a few questions. She's numbered them for me. How kind. That's brilliant. Very organised. 1. Is there always breastfeeding support available at the JR Spires Delivery Suite after birth? Every single member of our staff has been trained to help with breastfeeding. So yes, there will always be someone there to support you. All staff go through a full day training when they start in the trust. If they're midwives, they have nearly all of them come from UNICEF BFI accredited universities, so they have been having ongoing training on breastfeeding support and knowing all about feeding for the 3 years of their degrees. None of this is new to them. Our maternity support workers have on-the-job training as well as the full-day training, and our nurses too. So yes, there will always be someone there to help you. But remember, a baby is born expecting to be breastfed. Put your baby skin to skin when your baby is born, and as long as they're not too doped up with any medications you may have had, the likelihood is they will try and do it for themselves. So put them there, let them have a go themselves. Don't move them. It's back to that uninterrupted skin-to-skin contact. They're not to go off you to be weighed. They're not to go off you to have their obs. They're there, stay with you, not to go for a cuddle with dad until after the first feed, and that makes the biggest difference. So that's number 1.
And I think also that when you've gone home, your midwives in the community are your first port of call for support in that as well. So they're part of the John Radcliffe, but they will be your supporter in the community.
Absolutely, yeah.
You don't come back in for breastfeeding support after you've had your babies. Sometimes in the community ones, so Wantage, Wallingford, Chippy or Banbury, you can go back in for support for breastfeeding if you live in the local areas. But if you're in central Oxford, it's your community midwives that will give you your support in the areas that they work in when they see you after you've had your baby.
Perfect. Number 2, does colostrum come before or after birth? Before. So you may not be leaking, but some mums do. Some mums can't express before they have their babies, but this colostrum will always be there. It's there from in the tail end of the first trimester into the second trimester. So, you know, depending on how far along you are now, the likelihood is you've already got colostrum. As you're feeling your breast changes during pregnancy, and that's one of the questions we always ask, did you have any breast changes during pregnancy? Did you feel yourself get a little bit bigger and maybe a bit more tender? That's the beginning of your breast development going on. So yes, colostrum is there prior, and you, if you want to, you could express some from 37 weeks onwards, but there's no requirement to do that. You could learn the skill, and then afterwards it's removing.
And you might leak. So if you're getting clear fluid coming out of your breast, it's not something terrible, it's probably just colostrum. And you might get big blobs, you might get little crusty bits, but it's normal. And
you have colostrum until about days 3 to 5 after the birth. So when you deliver your placenta, so when your placenta's delivered, progesterone, which is one of the hormones, stops blocking blocking prolactin, which is one of the 2 main hormones for milk production, which allows the prolactin to work, which is why you go in to produce mature milk. So for the first few days you only have colostrum, and then it gets diluted by your mature milk, which comes in somewhere between days 3 and 5. So you'll have colostrum through pregnancy into the first week or so of birth. And your final question was, you said about expressing, should I bring bottles to hospital with me even though I plan to breastfeed? You don't need to bring anything with you, just bring yourself. So if for any reason you end up bottle feeding, we have everything here for you. And as Naomi's already mentioned, we have donated breast milk for those who intend to breastfeed. If you are intending on breastfeeding and donated is available, we will make it available to you whilst you build your supply up.
If your baby is not well, so if you've got an infection, we don't give it routinely at all. But if your baby's got an infection, or it's under lights, or it's lost more weight than we would like, and your supply is a bit delayed because you've had something happen to you in labour, and it's just taking a bit longer to build up, then we have, if you're in for that amount of time, we have got that available to you on the postnatal wards. I think not many hospitals have that. I think we're probably the only one in the UK that offers donor breast milk to normal, healthy term babies on a postnatal ward. It is a very rarity in this country, but we don't offer it in the community, so you don't get it when you go home if your baby's still not feeding and you haven't quite got enough milk at that time. We can't offer you donor breast milk in the community, as on the whole we don't usually do that. So that's why we need you to get working really early on, so when you go home you've got enough to give your baby when you get home, and you know how to get milk out of your breast when you get home, so you can then start to stimulate and increase your milk supply as your baby's days get older and older, because actually you need to increase the volumes every day of your baby. When you get home, you don't give 0.1 of a mil on day 3. You should be having increasing volumes at that point, otherwise you'll feel your baby probably won't do a poo on day 3 and 4 if you haven't got quite enough milk, and it will probably be slightly jaundiced because it's a little bit dehydrated, and it will most probably, it doesn't do that if it's got those two things present, will have lost more than 10% of its birth weight on day 5, which causes huge amounts of stress. So really work hard in the early days to make that milk so that you don't get to that situation, and then you will not be in the position where you haven't got quite enough, and that causes so much anxiety to mothers and stress with all the pumping and stuff that you have to catch up on.
You like our mum that we've been supporting up on the wards, because she really has gone from literally a glimmer on the end of a nipple to 55 mils.
But it's hard work.
Yeah, she's had to pump. She's pumped 8 times in 24 hours. She's done a brilliant job.
And hand express before. It's hard work, and
but
all the mums are doing it on the wards. As we speak, they go around and support, and the staff talk to us, and they're hand expressing and protecting their milk supply. It doesn't happen by magic.
If the baby's going on and feeding well, then you don't need to do this. Just to say that I know we talk a lot about pumping. That's because we sadly meet quite a lot of people who don't have enough milk, because they're the ones that we end up seeing. But there are plenty of women out there who babies feed from birth, feed beautifully, never have any issues, and the babies regulate the milk supply. The ones that we deal with when we get involved, as we said, if you end up seeing us, it's because there's probably a problem, and so that's why we end up talking about pumping so much, because we know that a delay in getting on with hand expressing in the early days, if things are not going brilliantly, can make a huge impact on whether you produce enough milk for your baby or not.
And it's so punishing, the regime of pumping, feeding, pumping, topping up. Feeding, pumping, topping up.
It's amazing how people do it.
They do, and if you do lots of it, you get payback.
So that was that question. So we've answered all 3 Rachel's questions. So yes, you'll get lots of breastfeeding support. Everyone's trained. Yes, you have colostrum in before you have your baby, and up to about just under 5 days after birth. And do you need to bring anything in with you? No, you don't need to bring anything. We will provide everything you need, including the support. So hopefully that's reassured you. Emma has said, if you hand express during labour and give the colostrum to the baby once born, do you still encourage the baby onto the breast, and how do you combine the two? Yes, you do, Emma. Do both. And actually giving your baby a little bit of colostrum is a bit like giving them a starter, because then they're ready for main course. So giving your baby a little bit of colostrum often wakes the baby up if they're a bit sleepy, and they go, oh, I like the idea of that, and they'll know, then they'll feed. So yes, do both.
It uses the gastric juices, doesn't it? And they start to wake up and lap and root, and you see them starting to do that, and they lick their lips. And if babies are opening their mouth and licking their lips, they're ready for feeding. If they're not sticking their tongue out and licking their lips, they're it's quite hard to make them breastfeed because they're not ready. But if you tantalise them with little bits of colostrum, as Alex has said, then they will start to realise that that's quite a nice idea after all, and they would like to try some.
And people do cope with doing a bit of both. It's never the intention of the long term. We don't expect women to be expressing in the long term. I know some women do end up doing that, but that's not the intention. The intention is always, you know, if they have to establish a milk supply, they might express, and then we always would intend that the baby is going to be breastfeeding if that's what they want to do. Some people choose not to and choose to carry on giving express breast milk. That's their choice. It's not the intention.
I think if you do that and you're pumping, but you need to suppress your breasts, because long term, if you're planning on doing that, if you pump 3 hourly, which is how people interpret it, we say 8 times in 24 hours. They say, oh, 8 into 24, that's every 3 hours. I'll pump every 3 hours. We never tell anyone to do that. It's no more than 3 hours, but surprise your breasts. So it might be that you do it after an hour, then you do it after 3 hours, then you do it after 2 hours, then you do it after 2.5 hours, and then after 3 hours, and so you're spiking your hormones. So if you do plan on not breastfeeding but pumping, you need to surprise your breasts to maintain your volumes, otherwise they will drop as you get closer to 12 weeks, and then you'll be your supply will go down, and that will cause you stress. So always surprise your breast when you're pumping, and you get a much better prolactin response.
So Hannah's tagged Chelsea on these and said she's found these really handy. So that's very nice to know. Thank you, Hannah, for tagging in Chelsea. Alexandra said, hi ladies, what are your views on combi feeding? I try to give no more than 1 bottle of ready-made formula daily, as she's still hungry in the evening when my supply is dipped. Is this okay? I heard it can hurt babies' tummies. Well, firstly, most women find they have a bit less in the evenings, or they feel they have less in the evenings, but what you have got is really high fat milk. How much time?
18%
exactly
more fat in your breast milk in the evenings than in the mornings. That's quite a big amount of fat increase, isn't it?
So if you think about
Yeah,
exactly. I was talking about like a superfood to someone earlier today, so explaining that it's really normal for women to feel they have less milk in the evenings because their breasts don't feel so full, and babies will often feed a lot in the evenings, but what they're getting is huge amounts of high fat milk. So small volume, high fat. So going with it as much as you can is considered to be the best advice, really, and doing the best you can. Giving formula does change the gut flora. It changes the pH of the gut, so the acidity of the gut, it changes that. So giving formula does change what's happening in a baby's tummy. So there are things that will be happening when you give your baby formula. We are lucky enough to live in the UK where giving formula is safe because we can make it to the right strength, and it's hygienic, and babies will benefit from nutrition, but it isn't the same as breastfeeding. So
if you give breast milk with the formula, so if you give a little bit of a breastfeed and then you give some formula, that will help to digest the formula in the tummy. Or alternatively, if you're fuller in the mornings, pump a little bit off and give your baby a bottle of breast milk in the evenings. And then it's not going to make them sleep any longer if you give formula. It's used to, years and years and years ago, they put all sorts of things in formula that made babies sleep for much longer, but it doesn't do that anymore. So you're not at any advantage giving formula versus express breast milk. So if that's an option and you've got a little bit more milk in the mornings, then pump a little bit off and you've got a feed for the evening if that helps. And you might find that is an alternative to what you're doing, and your formula is your backup. But your baby doesn't necessarily need to have formula to sleep longer or to benefit it in the evenings. But it's personal choice, and there isn't anything wrong with feeding your baby like that if that suits you.
We maximise on breast milk as much as possible.
Every drop is a bonus.
Yeah, absolutely. Right, that was Alexandra. Claire has said, hi, my baby is 8 weeks old and struggling with lactose intolerance symptoms. Would it be safe to try her on lactose-free milk? I don't know that there is a lactose-free milk, to be honest, because lactose is a really important sugar for your baby's brain growth. So if your baby is breastfeeding, then actually we probably would like to see you and have a chat, because if a baby's struggling, it is, yes, so maybe your health visitors, because actually babies have to have lactose. It's what fuels your baby's brain. It's a really important part of your breast milk, assuming your baby is breastfed. if a baby is lactose intolerant, it's actually to do with the fact of the lactase imbalance, and would be to do with positioning and attachment again. I know we go back to that all the time, but when it comes to a breastfed baby, I think this is probably one that would be well worth having a chat. But babies would not be lactose intolerant as such, because
it's quite rare to have a baby that age lactose intolerant, because their diet is lactose, and I think
huge amounts.
Could be that it's cow's milk protein, which is different if you have if you're breastfeeding and you've got high cow's milk protein and your baby's allergic to cow's milk protein. That is something possibly that you can discuss with your health visitor, but it's unusual to have babies lactose intolerant, which is very different, because breast milk is lactose, and babies are extremely poorly if they're lactose intolerant. And often, earlier babies, it's almost unheard of to see babies. They would be in Great Ormond Street, under specialists if they were lactose intolerant.
Because as humans, in human milk, we of all the species have the highest lactose, and the reason for that is because we're growing the biggest brains. Because if you think about your brain, it needs lots and lots and lots of sugar to work, and the same is for your baby. So lactose is the sugar that is in your breast milk that fuels your baby's brain. So I think, Claire, maybe it would be well worth a conversation with your health visitor or with us. We don't, although you're 8 weeks old, your baby's 8 weeks old, we would have a conversation with you on the phone, even though we can't see you in outpatients. But we can definitely have a chat about what's going on.
I think older people get lactose intolerant because as a species, we are the only mammal that feeds milk to adults beyond weaning, and so the body isn't designed to have milk products beyond weaning. We've adapted to it, so some of us tolerate it, and other people don't tolerate it, and certain cultures tolerate it less because milk wasn't as part of their diet routinely as it is in our European and third and first world countries, where it is often much more introduced into the diet and continues. But actually, we're not designed to have lactose as adults, but we've adapted to it. But actually, babies that aren't weaned, that are being fed milk feeds, don't tend to have lactose intolerance.
Yeah, so definitely worth a conversation. Perhaps you could give us a shout, and then we can have a conversation.
It does happen, and it's unusual. So I won't say it will never happen, but it's normally cow's milk protein that is the problem rather than lactose.
Hannah has said, can you explain hind milk, please? So, well, that's what you were just talking about, wasn't it, a moment ago? So with regard to the high fat, isn't it?
Yeah.
So we haven't got our picture here, have we? The
which one?
The one in the champagne glasses. Is that down on the bottom?
Yeah, I haven't got that.
Okay, so we had a lovely picture of milk in champagne glasses. One NCT, it was an NCT one, so when I was an NCT counsellor I used to use it a lot. So you had colostrum, fore milk, hind milk. So a lot of people don't like talking about fore milk and hind milk, and this fits perfectly with the question before, because when you let down, so if you leak, or when you first start, your baby first gets that first mouthfuls of milk when your letdown happens, that's the watery part of the milk, which is really, really high in lactose and all the water soluble vitamins. As the baby carries on feeding and feeds effectively, then they start to get the higher fat milk, and that goes up. The amount of high fat milk that they get is going up and up as the feed carries on. So a very full breast has an awful lot of lactose and slightly less of the fat, but there's a less full breast has higher fat content, so links in with the feeding in the evening.
Cluster feeds, yeah.
So feeding off a less full breast, a baby gets a higher fat proportion. Feeding from a very full breast, a baby gets a really high lactose.
Had a long sleep, say.
The higher fore milk proportion. So that's what we mean, but there's no, this is the beginning and this is the end. This is
when does it stop? When does it stop?
Yeah, this is fore milk, this is high milk. It's not like that. It's a blend, and the baby can get everything it needs in a 5-minute feed or a 10-minute feed or a 40-minute feed, and that could be the same baby at different times in the day. So a baby's ability to milk the breast is the key part of this.
And getting that positioning right.
Yeah.
Because if they don't, it goes back to what we were saying about, getting really full if they're not really deeply on the breast, because they're on and off, they're overstimulating the fore milk. And so the fat is in the ducts, it's attached to the ducts, and as the baby suckles, it gets bits of fat into the first milk that it gets, and then as the feed goes on, they start to suck more deeply, and the little globs of fat are pulled off the duct sides, and they start to take the fat in like little globs of golden fat, and it comes into the baby's mouth and suckles in, and it just sort of peels off the sides of the ducts of the breast. Yeah.
That goes with the whole thing about talking about positioning and attachment. If the baby hasn't gone on well, they've only got a little bit of breast in their mouth, they cannot milk the breast in the same way. They get rewarded with that waterier part of the milk, which is fantastic. It's full of lactose and all those water-soluble vitamins, but they don't get that heavier, fatter
pudding.
Yeah, exactly. So that's why they have to go on and have a big mouthful, and then they really milk the breast, and they get those fat globules, just Naomi's just explained.
And why we say don't take your baby off before it's finished, because it won't have been able to go through that whole cycle of feeding to get all of the bits that it needs to have in order to get the right calories. And you know, babies that don't get much fat get quite tummy achy, as Alex talked about the lactose imbalance, where they just they get lots of lactose going in, and the lactase, which is the enzyme in the baby's tummy, can't break it all down, so they get very gassy as the byproduct. So if you get the right mix of milk, they don't get this overload of lactose. But every baby gets full milk and hind milk, and if they're feeding properly.
Yeah. And a baby that may be having this imbalance of lactose and lactase may have green frothy nappies coming to the breast very frequently because they're constantly getting low fat milk, but maybe gaining weight beautifully.
Windy, very windy.
Yeah, unhappy, unsatisfied. So those would be the indicators. So I'm not sure if that's what you're seeing. I'm trying to remember.
But it's normally from poor attachment, and you can improve that by getting that deep latch that Alex has just talked about, and getting a really big mouthful on the breast underneath the breast. It really strips the milk ducts and gets the fat from deep within the breast as well. But you know, all the babies will do it if they're. You don't need to worry about any of it. If your baby's attached properly, they will get what they need, and they'll feel satisfied, and they'll gain weight.
So that was answering Hannah's question, and I also linked in to Claire's question. Right, Rachel's come back, so thanks for answering all 3 questions, really helpful. I'm a first-time mum and realising I have a lot to learn about breastfeeding. 31 weeks, do midwives discuss this at upcoming appointments, and or could you recommend helpful reading guidance? So I think there are some great websites out there of really good information. We talk about the Breastfeeding Network quite a lot. The Breastfeeding Network have some fantastic resources. La Leche League, so literally La Leche, as in milk, League, UK, have some great resources as well. OBS, Oxfordshire Breastfeeding Support, do some antenatal classes, and some of our community teams are now offering antenatal as well. And you should have a breastfeeding discussion with your midwives, and there's a breastfeeding checklist. If you have a look through your notes, go to your pull-out page where you've got where they put all your appointments. Then there's next page, and it's got the kicks count, and there's a page in there. It's called Antenatal Conversations. So if you haven't had that conversation with your midwife, pull that page, get that page open, and have a chat with your midwife about it, because that's part of your care. You should be having that conversation. It talks about sort of, you know, understanding why breastfeeding is important, and the importance of closeness and comfort, the responsiveness side of it, the building a baby's brain. There's all those things in there. And we have resources on our website too, so have a look on OUH maternity feeding, and we have plenty of information on there as well, so do that.
There's a great set of videos as well called Global Media,
and our videos.
Our videos, absolutely. That's on our webpage, but Global Media do lots of videos for parents as well, and that's on positioning and attachment and hand expressing and alternative feeding methods
and the breastfeeding in the first hours is the most gorgeous video, and we use it when we're talking to staff about what babies can do. How clever are they at going on the breasts themselves? So if you go Global Health Media and look at breastfeeding for the mothers, breastfeeding in the first hours is beautiful. And shows 3 babies. They've got
their own website.
It's going to be back to front,
but it looks like that, so you can recognise it if you need to download an app. But it's got all the videos on it as an app, and it's called Birth and Beyond, Global Health Media Birth and Beyond. And it's got lots of helpful videos that you can watch, and you can also put it into quite a lot of different languages. So if you're not a native English speaker, you can look at it in your own dialect or language. They've got quite a few dialects and languages on it.
And the other place we haven't talked about is UNICEF Baby Friendly Initiative. So if you put UNICEF Baby Friendly Initiative, and they've got lots of resources, and they have some information, written information in different languages too, which is also helpful.
Things like Kelly Mom are great as well, aren't they? It's American, but it's got lots of useful information as well.
Right, I'm going to move on because it is already
past our
22,
bedtime.
22, and we haven't got through all the questions yet. Steph has said, with the feeding and pumping to build supply, which I am still doing 4.5 weeks on from having my little boy, how long should I carry this on before coming to the conclusion that I just can't produce enough? I'm on domperidone, fenugreek, blessed thistle and lactation tea. I'm trying everything I can, but worried I will not be able to reach the milk supply for my little one. I also want to thank your team for all the support you've provided for myself and my little man. Oh, Stephanie, that's Stephanie. I know, you've been working so hard.
So frustrating. Sometimes it takes up to 3 months and mums turn around and say they're fully breastfeeding up to 3 months, but it's slow. Breast milk production is always slow, and it's not because you're not doing anything, and I think that just go with it, because the more stressed you are, the less you make. You get very stressed and very tense, and that just automatically stops it. I think look at what you have achieved and look how you've grown your baby, and your baby's getting food, and work with it, and if you need to, talk to us.
Yeah, absolutely.
Have a conversation.
Yeah. Well, we know Steph, so we've been in touch with her already, so yeah. Keep going, Steph, you know where we are.
You're such a star.
Alexandra's come back. Thanks, ladies. I'll try pumping it a bit more and give it a go. Okay. Claire says, oh, her baby is bottle fed. Okay, but your baby still needs sugar. So I think have a chat with your health visitor, Claire, and see.
Maybe that it has more protein in the bottle
maybe,
milk.
yeah.
It might be, and it might need more specialist milk if it's not gaining weight. And they don't gain weight. They've got very frothy stools. They've got a big rash all over them. They've got very, very sore bottoms.
Mucus and maybe even a streaks of blood in the nappies.
Being quite sick. So if those are the things that you're looking at, and your baby's not gaining weight, it might be something that needs to be addressed with your health visitor or paediatrician.
Definitely. I think to contact your health visitor. Hannah has said, I'm 39 weeks pregnant, recently had noticed a lump in each armpit but bigger on the left. I hadn't seen a doctor as assumed that was pregnancy or hormone thing. Do you think so, or should I be concerned? My toddler is still nursing, although my milk went at least a couple of months ago. I think the lump is bigger on the side I don't nurse her on, as that nipple is more painful. Well, that could be auxiliary...
tail of Spence, we call it.
Yeah, auxiliary breast tissue, because your breast tissue, sounds like I'm short, the breast tissue goes right up into your armpit, right up in here, and right, up into this area. So many women find that they can feel it up in this area, and it might be that's what you're feeling. That's exactly what Naomi's just said. It's your tail of Spence. So it goes up into a point up in here, and some women find that they're very aware of that area, and it may be that if you find that after your toddler has fed, that it eases, and then as you get nearer feed time it's worse, then I would suggest that it is to do with milk.
It's reassuring that it's on both sides.
Yes, yeah, bilateral.
But if you're concerned, go and talk to your GP.
Yeah,
but your milk ducts go right into your armpit and beyond. And did you get those lumps when your milk came in when you first breastfed last time? Because if that happened, then it's probably preparation for the birth, and your milk ducts are just preparing as your breasts get bigger. How many weeks? 39 weeks. So from 36 weeks, your breasts start to get a little bit bigger in anticipation of your, not everybody's, but you do get more breast development sometimes. So it might be that that's what it is. But if you have concerns, go and talk to your GP so they can look at it and log that you've got that there, and they can monitor it.
Okay, Olga has said, hello Olga, we know you too. Hi, can I ask about the dummy? I started giving it early, from about 5 days. I think it may have affected the latch. Shall I try and get rid of it now at 7 weeks? It's stressful as my baby loves his dummy. Well, we don't worry about it from that point of view so much, do we? We're worried about it masking feeds. So, anyone who's thinking about using a dummy, what we're concerned about is that a baby may use the dummy rather than asking for food. So that's where we have concerns that you might miss the cues the baby's making. And we have had cases of mothers who have got other older children and maybe have used the dummy to give them a bit more time to deal with the older ones, and has missed the cues, and the babies don't gain brilliantly. So I think as long as your baby's gaining and everything's all right in that respect, Olga, it's not going to be an issue at this stage. You're quite a long way down the line.
Is it at night that your baby has it? Does your baby suckle it all night? Because they say if your baby's soothing on it at night, then don't take it away from them.
Yeah.
Keep it going. But just make sure your baby's reaching its milestones. But if it makes your baby happy, that's good.
All right. So Hannah has said, if I need to come for breastfeeding support, do we still call and make an appointment at one of the at the clinics, or did I
as I did with my firstborn, we saw the JR and at Chippy before, and you found my daughter had a tongue tie and was the only person I saw that gave advice that made us a difference, and I sought a lot of support. Hannah, yes, you're very welcome to contact us for help. At the moment, I don't know that we're going to be having a Chippy clinic again for the moment. We are really hoping we might be able to reopen the one at Banbury. I've got Naomi sitting next to me because that's always been her clinics, Chippy and Banbury. She's not saying anything.
I miss you.
Yeah, I know. And we do miss having those other clinic appointments.
Yeah.
But our remit here within the JR has been so great. We've had so much to do here that it's been very difficult to open to reopen and have the space as well, because with the services not going back quite the same as they were before COVID. Yeah. There aren't the rooms available for us to use as clinic spaces, so
GP surgeries aren't accommodating the staff, so they have to use the hospitals to have clinics and things, so it makes it more difficult.
So at the moment, clinics are here at the John Radcliffe, and I know that's not great if you're from the north or from the south of the county, and it's fine if you're in the middle, but it does make things a bit more difficult for those that are a bit further out. And it's definitely a work in progress. We really hope it will change, but for the moment, clinics are here, and yes, we will see you here regardless of where you come from in the county. And yes, you can see.
We'd love to hear.
If you saw Naomi before, you're sure you can see her again. So. Rachel said, thank you very much, it's been really helpful. Hannah said, I didn't have them with my firstborn. Okay, so that was about it.
So it might be worth having a chat with your GP, just get them checked out, but it is reassuring that they're both sides.
Hannah has said, is it hard to get an appointment with Naomi now that there's less clinics?
Very. I'm very expensive.
No, we've been in clinic today. We both do Thursdays. It's worked out that Sarah and Elisa do Mondays, and Naomi and I do Thursdays. So yes, you can still see Naomi.
We'd love to see
get you an appointment, and it's lovely if we love seeing people.
About a week or so ahead, so we can't see you the same day or the next day, but usually about a week or so, maybe up to 2 weeks sometimes if you're really busy.
Right, well, it's nearly 10:02. So we've been on.
Have we got through all the questions?
We've gone through everything now, and I know it's been a rocky start. We haven't heard from our #1 fan today. No, Charlotte and Alicia. I hope they're okay.
Yes.
So
hopefully they're out enjoying the sunshine.
Yes, let's hope so. I think we've answered every question, and I'm really, really sorry if we've missed your question. I hope we haven't. I was quite careful going down. And I think, Claire, the main thing for you was to get in touch with your health visitor about your baby. I think there were someone else we said get in touch with us, didn't we? And Hannah, maybe have a chat with your GP about that area. I think that's it.
Questions
I
just
think
come
that's
up
done.
there.
Oh, we have there?
Just a few more. No?
Oh no, it's so Hannah has said that's reassuring about your appointments, and Olga said thank you for your response. Leo had his tongue tie divided 2 weeks ago, and I've been working on improving the latch, and I try not to use the dummy so much and offer the breast instead when he's unsettled. He's gained 300 grams in 2 weeks.
Oh, lovely.
He's exactly 7 weeks. Is this gain enough? That's 150 in a week, isn't it?
So about 210 for a little boy. But he's just had his tongue cut.
Yeah, so hopefully it'll get better and better. So you're on the right road. You're there. So,
but try and get a few more feeds in, because it's little and often with post tongue tie they get very tired. They get tongue fatigue very quickly, and it takes about 4 weeks for them to sort themselves out. So it might be just that they've got to build up their stamina with their tongue. It's just new muscles. So they have to keep working. So little and often is better. So don't mask those opportunities to feed if he has a dummy, because he might miss calories that he could benefit from.
Yeah, sneak an extra feed in here or there as much as you can.
Absolutely.
Right, I think we're going to say goodbye now then. Thank you very much, and thanks for all your questions.
Same time next week.
Yeah, should be. Yeah, you're not on annual leave yet.
Brilliant questions.
Brilliant
questions.
So.
And we love to have them. So
good
come
luck
back
to all.
Us again.
Yeah. Okay. Bye.
Bye bye from us.